Our next speaker is going to be Cunningham. Casey is the Chief CSO at Sante Ventures, which is an early venture fund, and Casey's been very instrumental in starting a lot of companies within the Texas area, and particularly Houston. He started his life as an academician before he went over to, I guess, the dark side of venture capital, but we're happy he's here to talk to us about opportunities here in Texas.
I'm going to begin by reemphasizing Neil's final point about shareholder value, because like it or not, the system that we as a society have chosen to develop our drugs and devices is capitalism. And if you don't like that, then you need to find a different way of doing it, but that's the system that we have. And so that means that you have to recognize that, and you have to attract investment that wants a return, investment that wants to do good, but there's a certain economic imperative there. So having said that, I'm often asked, so what do venture capitalists want? Or how do I pitch to a venture capitalist? And my answer is that may not be the right question, because here's Sante's data. This actually probably needs to be updated. But the take-home point is, have I got a pointer here? In the middle? Yeah, okay. Take-home point is here, that of all the deals we see, less than 1% actually make it into the portfolio. So when you ask, how do I pitch to a venture capitalist, what you're really asking is, how do I get struck by lightning? It's not just us. This is 2000 to 2009, so this year we'll do an update of these numbers for the last decade. The numbers will all be bigger, but the ratios will be about the same. And of all of the companies that are potential investment opportunities, 250,000. At the end of that funnel, 534 actually exited. So if you do the math, that means that of our 0.6% that we funded and put into our portfolio, more than half failed, didn't exit. So now, when you say, how do I pitch to venture capitalists, what you're really asking is, how do I get struck by lightning and live? And I would say that that's probably a question that you don't want to ask. Because really, entrepreneurs tend to, what they're really asking is, how do I get my company funded? And so they tend to think of investors as just this kind of sea of checkbooks out there. And if I can just get one of them to write me a check, then I'm off and running. But if you sort of step back for a moment and think, that sea of investors includes things like friends and family, angel investors, even granting agencies. You know, the Emerging Technology Fund in Texas was an antecedent, or CPRIT now. They're actually investors. They get some sort of financial return back for giving you an award. So every entrepreneur would say, well, sure, I can see there are differences in that among those different classes of investors, but they still tend to sort of lump institutional investors into one kind of smaller sea of checkbooks. But what I'm going to share with you today in just a few minutes, keeping on time, is that, in fact, there are differences among institutional investors. And understanding those differences is really a first step in deciding how you're going to pitch, or even who you should pitch to. So we'll skip over angel investors because you're probably already kind of familiar with them, and they can be very valuable for a startup company. They can also be really bad, but that's a different topic. So let's talk about institutional investors, because this is the category that most life science entrepreneurs are eventually either going to have to come to, or at least think about whether they should come to them, because nobody else can write that large a check. But institutional investors also come in many different flavors, and you have to recognize that. So there are traditional venture capital funds, that's what we are. There are corporate venture funds. There are family funds that can have venture and capital in their name, and other single LP funds. I'll explain the jargon in a moment. And then private equity, which is probably not applicable here because that's much later stage growth equity capital. But The key then to differentiating these different classes of institutional investors is to ask two questions. One is, where do they get their money? And the second is, what are they graded on? And so let's go through it, and I'll give you some examples. So corporate venture capital. That's a fund that there's a single source of money. And the source of money in the venture world is called limited partners, or LPs, and that's why you'll see it on the slides. So in life sciences, that single source of money is a pharmaceutical company. What that means is that yes, they want a financial return, but that's not the only thing they're graded on. And in fact, it's sometimes not even the major thing they're graded on. They shouldn't lose money, but Merck's venture capital fund can be the most successful venture capital fund in the history of the planet. They're not moving Merck's bottom line. So it's other things, other metrics that they're graded on, and that's finding new opportunities, new areas for their mothership pharmaceutical company. So that has implications. That means that portfolio balance is not important. It means that they're going to prefer in the pharma world, they want a platform or a pipeline of technologies, not a single product. MedTech can be a single product. They'll typically stay in the deal for multiple rounds of financing. They're less sensitive to the timelines, and they're less sensitive to the valuations. So how do you pitch them? The pitch you already love, science, because that's what they're in it for. Then there are other types of single sources of money funds. These are usually family offices or other foundation. That's becoming an emerging trend now in ventures to have disease foundation-backed venture funds. This fund size may be small, but they generally can go get extra cash for a deal-to-deal basis. And again, there's a performance metric that is aside from just financial returns, because wealthy family foundation offices are already rich. They don't have to try and get rich. They just want to stay rich. But they often have sort of quirks to them. So there'll be a disease that runs through this particular family, and they really are interested in that. Or even geographic locations. There was a fund out of Dallas for several years that could only do investments in Colorado and Texas, because that's where the family had homes. So that means the implications are that you'll get variable participation round to round. They are usually less sensitive to timelines and valuation. They're highly variable in terms of expertise. So a disease foundation venture fund can know a ton about the particular disease and how to develop it, but they may not be as sophisticated in other areas. A family office may be very sophisticated financially, but less so in terms of the science. So a good pitch to keep in mind is something that is to discover what those other metrics that they're being measured on and pitch to that, or be sure you include that in your pitch. And then there's the traditional venture capital fund, and that's what we are. So one of the big differences is that we don't have a single source of money. This is not our money. We are investing other people's money, as are all of these institutional investors. And we have to go raise money the same way you do. So when you put together a deck and go in front of a venture capitalist and pitch them and try and give them the reasons why they should invest, we have to do the same thing. So our institutional investors are pension plans and healthcare systems, big state agencies, things like that. So we have to go to them and say, entrust your money or some of your money with us. Here's what we're going to do with it. Here's the model we follow. Here's the process we use. Here's how we look at things. And then we have to apply that process. We can't deviate from that, because that's how we raise the money. And the only grade that we get is on financial returns. There are no other metrics. And those financial returns have to be of the entire fund, not just of the particular deal there. And that's something so that has some implications. So traditional venture capital is very sensitive to timelines and valuations, because it's all about financial returns and the deal structure. They're demanding. They want a high degree of control. They want board seats. Sometimes I drop into companies, sometimes as their chief medical officer. They want progress, but not just milestones, which are sort of how you measure the steps along the way. They want value inflection points, because that's what's going to determine when and how you raise either the next round of capital or the exit. They're usually in multiple sectors, and portfolio balance is important. I'll sometimes get, pitches in that says, we saw you just invested in this, I've got that too. And that's probably not going to work. So a good pitch is more deal structure and exit analysis and less science. Now, good science is the floor, for sure, but that's not what the pitch should be totally around. And here's why. Here's the typical life of a venture fund. It's a 10-year process. So when we get money from our institutional investors, we tell them this is committed for 10 years and that's it. That means that you have to do all of your investments in the first few years. And then you do some follow-on investments. You better start exiting about the middle of that. So one of the things that we have to do is transpose the typical life of a company, onto, went all the way back, the typical life of a company onto this timeline over here. The next timeline that we have to look at is the period that it takes to develop translational research into actual products. So this was from a very interesting paper a few years ago. Now they were making a different point, but I've always liked this figure, which is, so this first dots here are when you first start seeing publications about a new pathway or discovery or molecule. Then as you go along here, the circles are the first approval of a drug or a product from that. So in some cases it's pretty quick, but look, most of them it's way out here, and look at the timelines. These are in decades. So if I am going to transpose that onto that 10-year venture fund cycle I showed you, I've got to be very careful, because if I end up in one of these, I'm done. Now, another metric. So this again is 2000 to 2009. We've actually updated this, but this is all the life science exits over that decade. And of that 534 companies that exited, most of them were zero. And then you sort of have this long tail out there. Now here's the one that gets all the headlines, and people always think their opportunity is going to be. But if I do a 5% trimmed mean, it's right here. It's 156 million. Now I'll tell you that the updated figures for as of 2 years ago shift this line. Things have gotten bigger, but it only shifts it to about here. It doesn't shift it out here. So we're also keeping in mind that the sort of expected exit is not that billion-dollar drug that everybody thinks they have. It's at the time we get out, it's much smaller than that. And here's the surprising thing. People often think, well, of course it takes a lot of money. If I've got to raise this much money to assure success, there's actually no correlation between the amount of money raised and the exit value. And we've reproduced this data over and over again through the years, and it still holds true. You cannot say that if I just put more money in, I'm going to achieve a bigger exit. It doesn't work that way. So summing all that up then, the thing for you as an entrepreneur to do is to ask yourself, okay, what is my opportunity really? How early am I really? How much capital is it going to take, not just for this first check, but the overall capital profile? Do I want to sell the company, or do I want to go ahead and build a sales and marketing force? And if so, how long to profitability there? How much control? These are the personal questions. How much control are you willing to cede? What's your valuation expectations? And what do you need most other than the check? Is it networking contacts? Is it direct expertise? Is it guidance? What is it you need that's not just a check? If you do all that and then go back and remember these different classes of institutional investors that I talked about, it becomes kind of apparent who you should be knocking, whose door you should be knocking on first. So entrepreneurs have been told they should knock on 1,000 doors to get that first check. But I would submit that behind 900 of them, the answer's known before you ever knocked on the door, because your opportunity doesn't fit or does fit. And that leads to two sort of maxims or conclusions. If you can't easily explain how your opportunity fits your potential investors' metrics, then it's probably not a fit for them, and you can't force it. And if you do, by some chance, force it into the wrong investment model, it's almost guaranteed to fail. It's just the way it is, because your incentives are not going to be aligned with theirs. So with all of that, I'll say thanks and good luck to you all.